so that by the time the next baby will be arriving, there would have been a gap of 24 months in between the last delivery and the next delivery. This will allow for enough recovery time. Hello viewers, you are welcome to the Joyful Path channel. Today let's discuss about family planning and child spacing. Yes, this is 2025, and once again, there are certain things you need to know about child spacing and family planning. So guys, stay tuned. Family planning is a broad term of which child spacing is an essential part of it. Child spacing is very important. It is essential not just for the health of the woman, but also for the children, most especially the baby at hand, as well as for the benefits of the entire family. So this year, don't sleep on your child spacing and family planning goals. These things are very necessary, for you to stay healthy, to live well, to achieve whatever goal you have set for the whole family in this new year. Child spacing also allows for enough recovery time for your body to recover and get back to its normal position prior pregnancy and breastfeeding. So that is why child spacing is very important. It allows your body to recover, and it has been recommended that you should leave a space of at least 24 months between the birth of your child. That is, if your last child was given birth to last year, so you have to leave a space of about 24 months before the delivery of another child. So that is, even before you conceive after your last childbirth, you have to leave a space of about 12 to 15 months before the next conception, so that by the time the next baby will be arriving, there would have been a gap of 24 months in between the last delivery and the next delivery. This will allow for enough recovery time. Yeah, because the female body, the woman's body, goes through a lot of changes during pregnancy and breastfeeding. So when you actually leave this recommended space, that needs to look at, check your health history, your body. There are ways body reacts to different medications, as well as all these family planning methods. So your provider has to check all those things and then guide you towards making the right decision. That is it. So what are these options that we have? There are different ones, and first of all, the first one I would like to talk about is the withdrawal method. Yes, this is the pull-out method, and this method, it is recommended for people who have not yet completed their family size. Probably you just have one child, and when you just have one child and you are still looking forward to having another child, it is not recommended that you go for these other family planning methods, hormonal methods, most especially the injectable hormonals, because all these things, it can actually have effects on your normal menstrual cycle, which might take enough time for your body you have to actually work with your provider to know whatever side effects this method has, and know if it is good for your body. But please note, if you are on a particular family planning method and you feel that this method is not just good for your body is not responding well to it, you are actually having any adverse effects, you are seeing side effect that you feel is not good for your body, please immediately report to your doctor. It's good for you to speak out, and probably you can take it out, you can stop that method, try another method, but don't keep silent when you know that your body is not responding well to a particular method. It's okay for you to speak out. Another method I would like to talk about is the hormonal injectables. Yes, these hormonal injectables are the injections that has to be taken in about every 3 months, and this one is also very effective, about 99% effective. Yes, so when it is taken regularly, it's also very effective, just that it's also. So another method we'll be talking about is the emergency pills. Emergency pills, like the name implies, it is meant to be used during emergency, in an emergency situation whereby you do not plan for intercourse. Maybe when an unexpected unprotected intercourse happens, then you can use these emergency pills. So it is not meant to be used frequently, it is not meant to be used or taken as a supplement like vitamin C, like water. No, it is just to be taken in emergency situation, and this pill is only effective when it is taken between 24 to 72 hours after having this intercourse. So if you take it in the first 24 hours, it's going to be very it's going to be more likely effective than when it is taken 72 hours or after. So the best time to take it is between 24 to 72 hours post the unprotected intercourse. So that is how the emergency pills work. Then another method I would like to talk about is the contraceptive pills. Yeah, this is the pills that it's also a form of hormonal method, and this pill has to be taken every day. For it to work effectively, you have to take these pills every day. And there won't be fertilization, and once the sperm cannot get to the tube, there would not be pregnancy. This method is also very, very highly effective. And the second option for the male is the vasectomy. Vasectomy is the method in which the tube that carries the sperm from the testicles to the urethra is being cut. So this tube that carries sperm is also a surgical method where this tube that carries sperm is being cut, and once it is being cut, the sperm cannot be transferred from the testicle to the urethra. So this method is also very, very highly effective if it is done, but they are permanent methods, they cannot be reversed. The only thing is that once the man go for this method and the tube is being cut, the man has to use other method for the first 3 months, because sperm can still survive in the man for about 3 months. So for the first 3 months, the man might have to use barrier method or any other method as family planning method until 3 months post the surgical procedure before this method can become effective. So those are those options for the permanent method. And the last method, which is the most effective method, 100% effective, this method is abstinence. Yes, so if you know that you are not ready to bring up children, you are not ready to get pregnant, why don't you just abstain? If you know that you don't want to go for any of these options, abstinence is the method that is most reliable and is sure that you won't get pregnant. So guys, those are the methods you can consider for your child spacing and family planning. So one thing you should consider is, number one, consider your family size. If you know you've just had 1 or 2 kids and you still want to have more, so for you to avoid the stress, some side effects, that can come with family planning methods, and the fact that when you want to stop a method and you are considering getting pregnant again, for some people their body might take some time, for some people their body might take some time, to be regulated back to the initial system. So it is actually good for you to consider other options like the other methods, the barrier methods, the withdrawal methods. And once you know that you have completed the family size, then you can go for other methods like the hormonal methods and all. So it is very, very important for you, to reach out to your provider, your doctors, in order for them to guide you through making the best decisions when it comes to child spacing and family planning. But most importantly, this year, do not take chances. Please do not sleep over on your child spacing and family planning goals, because it is very, very important for your benefits as a woman, for that of your children, and that of the entire family. So guys, see you next time. Thank you for joining. Thank you so much for joining us in this episode. Please do not forget to give this video a thumbs up. Do not forget to subscribe. Don't forget to share and comment. See you next time. Thank you.